In this video, we're going to review superior vena cava syndrome associated with central vascular access device use. So, description of superior vena cava syndrome. It is a serious condition caused by obstruction of blood flow through the superior vena cava, right here. Obstruction occurs by extensive vein thrombosis that compresses from several sides or from the inside the superior vena cava. Multiple catheter use, such as central vascular access devices, increased use of central vascular access device can lead to increased incidence of superior vena cava syndrome as the result of a venous thrombosis. So signs and symptoms associated with superior vena cava syndrome would be headache or visual changes because of the backup of blood into the upper body and dilation of the cranial arteries. Fear as the result of decreased O2, peripheral edema, periorbital edema, cyanosis of the face, neck, and shoulders, again from insufficient oxygenation of the blood. So the patient will experience shortness of breath. They will also have a cough, engorged and distended jugular veins, then also distended veins on the chest and the upper limbs. As the blood is backing up into the upper body. Patient will also experience tightness in the chest. Also unilateral edema may be present if the central catheter is on one side and the blood is not leaving that extremity. Also, the edema may be present in the upper body. One of the signs that edema is present in the upper body but is not present in the lower extremities. That can be the sign of superior vena cava syndrome. So prominent vein pattern usually present over the chest from dilated thoracic vessels, and also potential for bronchial obstruction that will lead to cerebral anoxia as a result of increased intracranial pressure. So some of the things that can be done to prevent this from occurring, prevent superior vena cava syndrome from occurring, is obtaining or verifying proper catheter tip placement with radiographic examination, and it should be present above the right atrium in the superior vena cava. Also, before placing multiple central vascular access devices, it is important to consider hypercoagulability if the patient is hypercoagulable, which increases risk of clot formation or thrombus formation in either the arteries or arterial or venous circulation. So some of the things that can be done to treat this. So some of the things that can be done to treat superior vena cava syndrome as a result of central vascular access device complication could be, first you would notify the provider, practitioner, then confirm the diagnosis by using the radiographic examination. Treatment in the case of thrombosis would include removal of the catheter and initiation of thrombolytic therapy such as TPA or heparin. placing the patient in semi-Fowler's position will help with oxygenation, and adding O2 to the treatment would help the patient oxygenate the blood. Also monitoring the fluids, how much the patient is taking, and decrease them as possible to decrease edema and the circulatory overload that is happening in the upper body. So this concludes the video on superior vena cava syndrome associated with central vascular access device use. I hope you enjoyed this video. Thank you for watching, and I wish you great success.